All right, thank you, Dr. Lai. So after we learn some information about the dental school, so let's move on to our third part. Let's talk about the dental career. So maybe I will pass this question to Dr. Shen. So what are the career options for students with a dental degree? Since you are an orthodontist and then Dr. Lai is a dentist, what other options are available there?
Um, After graduating for Asian from a dental school, basically you get the DDS or the DMD degree here in America, and then you are actually allowed to uh, set up your own practice and practice dentistry. You don't need an internship or anything, and you can directly get your dental license from the state and start practicing. And some dental graduates, they after they graduate from dental school, they feel like they want to specialize in a certain field of dentistry. There are actually currently there are the specialty in dentistry. We have orthodontics, endodontics, root canals, periodontics, gums and bones of the teeth, and oral surgery, wisdom teeth and jaw surgeries and that kind of stuff, and pediatric dentistry, geriatric dentistry, and then forensic. You can do forensic dentistry too. And then also there's a new specialty coming up, which is handicapped and handicapping dentistry, like dealing with handicapped and physically challenged patients. So there are actually a lot of other different, or actually you can go into public health, and you can also go into dental research. So there are a lot of different subfields you can get into in dentistry. Being a general dentist is actually the most challenging one because you have to be good in every one of them. Because you take care of your basic patient's need with all the above subspecialties. And but then if you want to go into a specialty field, they're usually about 2 or 3 years of additional study to graduate from that. Mm-hmm.
All right, thank you, Dr. Shen. And since we talk about different career options, I also want to know what are the latest innovations or technology in the dental industry right now. Would you like to share a little bit more with us?
Yes, I'm an orthodontist, so I deal with mostly braces and Invisalign. When I first started practicing, they were all braces, like these stainless steel brackets and wires on the teeth. And then around 1990, 2000, there's a plastic aligners coming out of the market from the company Invisalign, and it's using CAD/CAM technology and also using digital scanners or intraoral scanners. We scan the teeth, and then we get an image, a 3D image of the person's teeth, and then from that we line up the teeth virtually, and then Invisalign, the company, will make those trays, the aligners for the patient. I'd like to share screen right now. And yeah, you can see that right here.
Mm-hmm.
You can see the teeth. This is a patient's teeth before, and this is the scan, the 3D scan. You can actually look at it in different ways. And this is the upper and lower, and then this is the before. And then there's a software we use to actually program the teeth to get into shape, get into alignment with different stages. And for this person, you can actually see there are a total of 33 stages of aligners, 33 aligners, and then the teeth can actually go from being a little bit protrusive, a little bit narrow, to become completely straight with a good bite. So before you even start treating the patient, you can actually show the patient what the patient's teeth are going to look like after he or she's done. So that, I think, is a great technology we use in our office. And also we don't take any impression using the gooey stuff to take impressions of the teeth anymore. We basically use the intraoral scanner, and which is about 40 times more accurate than the impressions. Another technology I want to share with you is the cone beam technology. And in the old days, this is what we use to show like a third molar here, the wisdom tooth that's impacted, you can see, and then you can faintly see a piece of nerve here that's running behind, below the tooth, you know, and it's a 3D image. And that's all you get in the old days before we had a cone beam. Cone beam is like a 3D image of your teeth, okay? And let me see, and then see if I can share another one. Mm-hmm. Okay, I have to find that slide. Okay, turn that open. Here's an image of a 3D image of that same third molar. As you can see, you can look at the tooth, look at the nerve down here, and look at it in 3D. And before an oral surgeon will remove that tooth, he will have a complete knowledge of how the angulation, and then what's the nerve involvement with that tooth. And so you get a better picture of how you should approach this procedure. Okay, it's very valuable for us, and also for general dentist, oral surgeon, and I'm pretty sure Dr. Lai can talk about doing implants with cone beam technology.
Yeah, so with regards to what Dr. Shen is showing you right now, we don't do the implants per se. That we have oral surgeons that do it, but what he was saying that oral surgeons can look at this image on your screen and see where the bone level is, and because of that, because of this new technology, they can put the implant, which is basically a metal screw inside your mouth, and that will act as a, if a person loses a tooth, it will act as a regular tooth there. And so basically they can insert the screw into a certain area where there's bone, and then you can build a tooth on top of that and rebuild a person's smile with that type of technology. So dentistry is definitely advanced now. You know, one thing that's cool and it's interesting about dentistry is that it's constantly changing, and there's constantly new materials, new procedures that are coming out that is really, you know, providing new avenues to take care of someone's teeth a lot better, and you know, make things last longer. Dr. Chen was showing you the intraoral scanners that he's doing with Invisalign. We can definitely scan a person's mouth, and if a person needs a filling or needs a crown, we can actually scan the person's mouth and fit a crown that same day with a printing machine, a milling machine that can mill the crown or mill the filling right then and there. And so usually when you have to do any type of restorative procedures, you have to take a mold of the person's mouth and send it to the lab, and wait a couple of weeks before it can come back to you. But now dentistry is definitely progressing towards a digital age where you're able to gather all that information really fast and make a certain restoration or treatment that same day. So that's another thing that's very interesting, and what attracts people to dentistry is that it's ever changing, and it's not all cut and dry about, you know, medical is like, hey, if you have this disease, you have these symptoms. You know, there's different ways of treating certain, you know, problems with people's mouths. So that's a very interesting part of why this is called the golden age of dentistry right now, because there's so many new different types of technologies that are coming out.
Well, thank you for sharing, Dr. Lai and Dr. Shen, for all these innovative technologies that I never seen before. I'm really impressed by that, and I do agree on our society is changing constantly every day. There's a lot more we have to learn for that. So, the next question I have it for Dr. Shen. So I know that Dr. Shen, you own your practice for quite a long time. So what will you look for when you need to hire someone? When you need to hire for internship? When you need to hire for assistants?
Dentistry is a field that no dentist can work by himself or herself. So you need a team, right? And in the dental office, you have a front desk, back office, the dental assistant, sterilization, treatment coordinator, and the lab person and all that. So basically the person has to be a team player, and a person who can motivate the team or who can innovate or actually lead the team will be the winner. So we always look for a team player. At the same time, the person has to be, dentistry is actually a health profession, but the practice of dentistry is actually a service industry. We are in the service of providing care for our patients. So the team members should be actually very good in customer service. Like Yanni said, with almost everything nowadays, any business, the customer service is very important. So we do want somebody that has a very good level of customer service in our team to take care of our patients, like communication, people skill, and all that. Yeah, so these are the few things we look for. And of course, the technical part, but I think the technical part is fairly easy, compared with the customer service and also being a team player.
Okay, thank you, Dr. Shen. And if Dr. Shen or Dr. Lai, you ever recruiting someone, just let me know. I'm going to help you to spread the words to the connections I have. Yeah,
Thank
Dr. Lai, you're welcome. Dr. Lai, do you have anything to add on?
Yeah, I think, when you're hiring a dentist, you really want someone that has confidence in themselves. I think, like I said, dentistry is probably as up and close and personal of a profession as you're going to get. You're working in someone's mouth, so you definitely really have to have confidence in being that close to somebody, and also like Dr. Shen said, very customer service, because like I said, we are providing a service. It's kind of the only profession where you're really taking care of somebody's needs, or health needs, and also providing a service for them. So the main thing is always keeping them as comfortable as possible, and making sure that they trust you as the dentist. And so definitely when you're hiring someone, they have to be very pleasant, be very nice, be very trustworthy, definitely smile a lot, and really just enjoy being in the environment that you're going to be in. And I think that's for any type of workplace too. I think when you are in a very comfortable and happy environment, that bodes well for any type of service or profession too.